Hi, everyone. It's my pleasure again to have with us Dr. Suman Chakrabarti. He's an infectious disease specialist from Mississauga, and he's a native Sarnian, and we're happy to have him back again to answer some questions, mostly about the COVID vaccine now that we finally have it in Lambton County. Thank you so much, Suman, for joining us today.
Always a pleasure to be here and talk to people from Sarnia.
Thank you. As you know, we finally have effective vaccines, at least two approved in Canada, Pfizer and Moderna, against COVID-19. And the studies and even real world situations have shown high efficacy and effectiveness against the virus. We're looking at 94, 95% effectiveness. Having said this, many people have very good questions about the vaccines, side effects, safety profile, before they make a decision about getting it, right? So since we have you here, I'd like to ask you some questions, and we'll hear back from you as being an infectious disease expert. The first question I hear is, how long does it take for the vaccine to have some effectiveness and some protection once we get it?
Yeah, that's a great question. So first of all, I want to say that people that have questions about the vaccine, that's absolutely a good thing to do. I don't want anybody to think that if they have questions that people in our field think you're an anti-vaxxer, because that's certainly not the case. It's new. We need to know some information about this. So when you do get the vaccine, it's not a sudden all or nothing response. It takes several days to ramp up, but generally you're starting to see around the 7-day point, 10-day point, even 12-day point that you're going to get an increase in the amount of antibodies in the blood. But it is really important to remember that you're not completely protected. But usually by the time you get to the 3-week point in the trial where you're getting the second shot, you're pretty well protected. And that second shot is just making that first one more vigorous and giving you a long-term protection. So just remember that you're not protected immediately afterwards, but within a couple of weeks, you're starting to really show some signs of protection.
Thank you. Another question I get is, let's assume we have the vaccine and in a couple of weeks we have enough antibodies and get good protection. Does that reduce the chance of us giving it to someone else if we're asymptomatic carriers, if the virus is somehow sitting in our nose?
Yeah, and this evidence is rolling in directly right now, but it's a lot of indirect evidence. We do know that because it takes any severe disease or symptomatic disease and makes it asymptomatic, right there we know that the efficiency of transmitting it to somebody else is greatly reduced. But now, yeah, we're starting to see evidence too that once you get the vaccine, maybe you can still pass it. There's a low risk of it, but it's much less than if you're not vaccinated. So right now, we still suggest for people to be wearing masks and being careful as it's transitioning to the whole population. But eventually, this will allow us to get out of these restrictions and is our ticket out of the pandemic.
That brings me to another question. So what's the point of getting the vaccine if we still have to have a mask on and keep our distance?
Yeah, this of course is more of a risk-based thing. It's something that's temporary just because not everybody is going to be vaccinated all at the same time. But that said is that I do want people to realize that this is just because we're in the transition phase, but this is a means to an end. And that end will be hopefully at some point in the late spring, early summer, where we're going to start to see the restrictions relaxed. And by the end of the summer, I suspect that some people will still be wearing masks because they're worried, but for the risk factor of it, these things will be hopefully removed, at least in the public, very soon.
Thank you. One question I hear a lot about also is, especially from our younger staff who are contemplating starting a family, is what's the risk for either pregnancy, if you're actually pregnant now, or planning to become pregnant?
Yeah, this is a great question. The same questions came up at my center as well. So if somebody is pregnant, we know that the risk of severe disease from COVID is certainly there, especially the risk of being hospitalized. So I have recommended the vaccine for many people who are pregnant, and they've gotten it safely with no problems to the pregnancy. Fertility, I understand that issue as well. And NACI has come out saying that, you can wait for about a month after your second dose. But that said, if you look at it theoretically, unless you're getting a major febrile reaction soon afterwards, conceiving after the second dose, even if it's a week later, it's not going to make any kind of long-term risk factor. But that's what most people are doing right now, is waiting until they've had their second dose. A lot of people get fevers with the second dose, and once that's resolved, then it's safe to get pregnant.
How about the population that's immunocompromised, whether due to the illness or medications?
Yeah, this was somewhere where I had a little bit of an issue with the NACI recommendation. People who are immune compromised are exactly the populations that we want to be getting the vaccine. We do think that the vaccine might be a little bit less efficacious there because the immune system doesn't respond to it as well. But that said, it is completely safe to get it. And yes, anybody, for example, on biologics for rheumatoid arthritis, for example, or lupus, or people who are on cancer chemotherapy, we especially want you guys to be getting the vaccine, and it's safe in this population, and it will be rolled out to this population in the coming weeks to months.
So speaking of safety profile, one of the reports I found that out of 18 million people who were vaccinated with Pfizer, about 66 developed severe allergic reactions, anaphylaxis, most of whom had a prior history of allergies. Even though 66 out of 18 million is a small number, but nevertheless, it does lead to some anxiety among some people. What do you say about the safety profile of the vaccine?
Yeah, you have to also remember that right now there's a microscope on everybody who's getting the vaccine. So I agree that 66 out of however many million, that's a tiny fraction, and it's certainly much lower risk than actually getting COVID if you have risk factors and getting sick. So I think that, looking at the whole picture, it's a much beneficial risk profile from getting the vaccine itself. There are certain people that have anaphylaxis to the components, most notably PEG, but it's again rare. And if you're worried, you can see an allergist, but for the most part, in my experience for the past couple of months, most allergists are saying that the risk is very, very small. Get the vaccine, and it's done in a monitored setting if anything ends up happening.
Yeah, so some questions I get also about the more medium and long-term potential complications of any of the vaccine, given that it's a new vaccine. So what do you say to those people?
When we look at vaccine, this is the type of vaccine that it's causing a fairly quick inflammatory reaction, which it's the mRNA, for example, for Pfizer or Moderna is in your body and then it's out of your body. So it's very unlikely to have any long-term effects. We do see that in trials that if any kind of, I want to say medium-term effect happens, it generally happens within about 3 months. And the trial showed that it was very, very safe in that regard as well. There's a low risk of something happening in the long term. Obviously nobody can ever say zero risk, but that risk is dwarfed by getting COVID itself. And of course, we want to get out of this pandemic. So the risk of having further pandemic spread is, of course, there as well. So I think when you look at the risks and the benefits, there's a tiny, tiny long-term risk that I think is negligible. And I think it's much more beneficial for us to get the vaccine.
That's great. How about the whole talk about the different variants that might evade vaccination and the potential talk about this third wave and things like this? What's your feeling about all this?
Yeah, there has been some sign in snapshot studies looking at people's serum that they have been, slightly less reactive when they get the vaccine with certain variants, for example, the South African variant. But one thing, if you look at all of the trials, you can see that if you look specifically at hospitalizations and death, whichever vaccine it is, and whether there's a variant there or not, the risk of death and hospitalization is greatly reduced, if not completely eliminated in some of the studies. And that is the main metric that we're looking at. So let's say if you get one of the vaccines and you end up getting COVID, but it's just a sniffle or a sore throat, that's much better than getting hospitalized. And that's what I think we should be setting our sights on. If we have something that reduces greatly the risk of hospitalization, that's a massive public health win. And again, it's our ticket out of the pandemic.
Yes, I mean, as more people get vaccinated, the chance of the virus growing and replicating and mutating and creating more variants drops, right? And the last question is, what if someone had COVID in the past? Should they get the vaccine? And if so, how long do they have to wait?
Yeah, and this is something that we're learning more about right now. So the NACI recommendation for non-healthcare workers is waiting 3 months, and partially is because once you get COVID, it's very rare to get reinfected within that period. For healthcare workers, we're saying that if you've gotten COVID, we say to get it as soon as you feel better and it's safe to go out. We are seeing some evidence that if you've had COVID before, you may only need one shot of, for example, Pfizer or Moderna, but that's not quite hashed out yet. So for right now, for healthcare workers, if you've had COVID, we say that as soon as you start to feel better, go get the vaccine. You might not have to get the second vaccine, but that evidence will come later on in the year, where I suspect it's just going to be one required.
That's just great. Thanks for the review and the discussion about the vaccines and the third wave and side effects and benefits. And one last question. What's your feeling in terms of how many of us need to be vaccinated to achieve the so-called herd immunity? Is it 70%, 80%, 90%?
Yeah, it's interesting. 70% is what you think about when you see a virus that everybody has the same chance of transmitting. But the interesting thing with COVID, you often have a small group of people who result in the super spreading of cases. So you might find that you need even less than that to be able to break these transmission chains. So the point is, if we have vaccination to the point where we're having cases, but we don't have hospitalizations that are overwhelming healthcare systems, and to be honest with you, that's also a huge win as well. You may not even need herd immunity. So to be honest with you, we have seen these numbers, 70 to 80%, but it could be a lot less than that. And the point is, as long as you're not having hospitalizations in the people that are getting sick, that is our main goal. And that's going to be getting us out of the pandemic and out of these restrictions, most importantly.
So do you feel from your experience and what you've seen so far is that hopefully as vaccines ramp up and we have better testing and tracing, and can we convert this to a more controlled endemic virus as opposed to the widespread now, and maybe have a, maybe not completely normal, but close to normal life by summertime or full time?
Yeah, and I would say, yeah, very close to normal. By the end of the year, probably pretty normal. But I do think, yes, that the COVID virus is going to go more into a endemic type of virus that we see, for example, with influenza. We may have to deal with, very limited epidemics during the wintertime like we do with other viruses. But it's something that we can easily manage without community restrictions. But something, of course, in the healthcare system we have to be aware of during the flu season. And I suspect it's going to become part of our respiratory multiplex when we're testing patients that come in with respiratory illness, especially in the winter months.
So hopefully one day we'll convert COVID to become more like a common cold or influenza. And do you think that maybe one day we might have to have booster vaccines as it changes potentially and we get more variants?
I think so. Yeah, I think that maybe in a couple of years we might need a booster, and with mRNA vaccines especially, that's something that's very easy to tinker with to be able to get that that effective booster. But yeah, we just have to remember that we're not going to eliminate this virus, but living with it in a more, a situation that's much more familiar like influenza, that's fine with me. And that we have to remember that this is something that happens on a yearly basis. We don't need community restrictions to deal with it. And it's something that we can live with, especially with the advent of vaccines that, remember, a year ago we had no vaccine in existence, and now we do. So we're going to be out of this soon. And I think the summertime is going to look a lot more normal and definitely a lot better than last year's did.
And that's the optimist in me. I'm hoping, the weather is getting better. People will go outside more. Outdoors definitely safer than indoors, and have more vaccinations. And hopefully we'll have some normalcy coming in. But that's it's always good to end on a high note and give people hope.
Hope is one of the biggest things that we have, and the light is at the end of the tunnel. It's getting really close, and it's within reach now.
And hopefully, even if we have a third wave or wavelet, as you called it, if we have enough of the high vulnerable population vaccinated, hopefully it won't lead to as much death and misery and hospitalization.
That's exactly right. I think that third wave we have to be prepared for, but it doesn't necessarily mean it's going to be as big as the second wave was. And that's another thing too. As I mentioned, we have to take away our reliance on this daily case count, because as we have more vulnerable people vaccinated, if you get a lot of cases, if there are not as many hospitalizations, you can absorb that. And that's, I think, what's important. Doesn't mean we should be opening up to concerts right now. But what it does mean is that things are going to look different, a lot better. And as the vaccine rolls out in the coming weeks to months, things are going to be getting back to normal.
So proceed with caution, keep up with the usual safety measures for now until we have enough people vaccinated, and hope for the best.
That's exactly right.
Dr. Chakrabarti, as usual, thank you so much. It's been a pleasure, and hopefully we'll see you in Sarnia.
I'll be there soon, hopefully on a patio.
Thank you.
Take care. Bye-bye.
Bye.